Today's date is December 8th, 2015. We're here with Nupur and her son, Aryan.
Hi.
Thank you, Aryan. And Nupur, I have your permission to make a video of you and your son. Is that correct?
Yes.
And you're letting me video you too, correct?
Yeah.
Thank you. Nupur, how old's your son?
He's 10.
And he's got a learning disability, correct?
That's right.
And they say he's got a fairly mild form of autism.
Mm-hmm.
And you brought him to us, and he's getting some therapies, including IV therapy. He's getting ozone therapy, the therapy called the PK or Patricia Kane protocol, and he's getting some minerals and some supplements.
That's right.
How many IVs of ozone has he had so far?
Today's our second visit.
Second, so he's had one.
One before.
Today is the second. And with just one session, how long ago was that?
About 2 weeks ago.
Okay, what have you noticed?
I did notice an improvement in his concentration. He's able to sustain it longer without prompts. He's a little calm in general. We did notice that, and it was not apparent just after the session. It took some time for us to kind of realize the gains.
Okay, it took a little bit of time, several days to realize some gains.
Yes.
And you told me he's happy with it.
Yes.
What has he said?
So you wanna ask him?
I will. Let's ask him first. Aryan, you got a nice smile on your face, and obviously you wanted to come back today. Is that correct?
Yeah, and I'm really happy that I can work independently.
Is that a change for you? You can now work independently?
Yeah. I feel that's changed me.
It changed you. How soon after the treatment did it change you?
And the day after or
A
something.
day afterwards. Okay.
I'm not sure, but I'm just guessing.
Yes. Did you notice anything else besides being able to work independently?
That's pretty much
That's
it.
pretty much it. Okay. I really appreciate you telling me this. Thank you so much.
You're welcome.
Oops. And what else might you have noticed besides what he told us? Is that pretty much it, that he's working independently?
Yes, I do think he's calmer in general, and I'm hoping that with more treatments we'll be able to see more gains.
And what does working independently mean?
Means like he usually, when he works on his schoolwork, he needs someone sitting by him, kind of telling him, okay, now do this, he needs prompts to keep working, and working independently means he's able to work longer without being prompted.
And from my perspective then, he was able to concentrate and focus and not be distracted because he didn't need somebody prompting him. Is that accurate?
Yeah.
Okay, thank you. And I may post this, yes?
Sure.
Thank you. We were just having a very interesting conversation about the paradigm in this country with regard to learning disabilities. That's what we're really dealing with here. And the paradigm in this country is to give a chemical like Ritalin or a stimulant to suppress a symptom. You were telling me your thoughts on this too, please.
Right. So usually when you go to any regular doctor, I'm not saying you're not regular, you go to any doctor covered by insurance, conventional
insurance doctor.
Yes. And you explain the symptoms. They would, the best advice I've got is, okay, it's either a behavioral change, how you teach kid, or put him on medication, ADHD medication. Nobody has tried to talk about healing the body to fix the symptom. So that's what I see we are getting here.
Thank you. And that's what I'm trying to do, and my colleagues who do this type of medicine, we're trying to do. We're trying to get the body to heal, not to put a Band-Aid over it and the drugs are like putting 100-pound weight on your brain.
Right.
It just suppresses. It doesn't really fix the issue.
Yeah. Yeah. And one more thing I want to talk about. So after the treatment, I did feel that Aryan got a little better self-control because he's now able to resist the food that are not good way better than before.
That to me is really significant. In other words, he can control an impulse not to eat foods that are not good.
Right.
And that is a real problem in the children with the learning disabilities and brain injuries, because they gravitate, they go for those foods like milk and wheat, which make them worse.
Yeah.
It's
So he's able to control his impulse, and he now wants to eat homemade food and healthy food.
Oh my God, you made my day. Thanks.